And welcome back to the final lecture for Chapter 5. So here we're going to talk about diseases and injuries associated with the integumentary system. Then we're going to move on to aging and the integument. So the different diseases that we typically talk about are cancer. There are 3 types of skin cancer, which is the most common type of cancer that you can have. Eczema, which is an allergic reaction. Psoriasis, an autoimmune disorder. We've talked about acne, but we're going to look more at severe acne or cystic acne. And then we'll talk about burns, okay? So here, this is a basal cell carcinoma, very commonly found on the head and neck. So in your face, head, neck, anywhere that you typically have more sun exposure, and so your head and neck is always exposed to the sun, whereas your arms, your legs are not always. Basal cell carcinoma forms from the stratum basal layer. It is the least malignant type of cancer, which means it typically doesn't spread, and it's usually very easy to treat if you catch it early. They can get rid of the cancer, they cut out the cancerous tissue, and then you are advised, highly advised, to no longer go out in the sun without hats and without extra protection, because once you have one carcinoma, you're more likely to get another one. This is squamous cell carcinoma. So in this carcinoma, again, it is typically, if it's caught early, able to be treated. They can cut out the cancerous tissue and then the tissue will heal. It is more likely to become malignant than basal cell, but it's not as serious as melanoma, which is the serious cancer. This cancer also forms mainly on the head and neck, and because that's where we get most of our UV radiation. It forms from the stratum spinosum layer of epithelium. And here's that really bad one. This is malignant melanoma. Melanoma is very likely to spread, and if it's not caught early, it's very dangerous. So you want to identify it early and get treatment immediately. Melanoma is cancer of the melanocytes, so it arises from a melanocytes, and it usually presents as a mole on the skin that has a unique shape and is very tender. So we use the ABCDE to diagnose, and here's what that means. We look for asymmetry. So normally moles are relatively symmetrical. We want to look at the borders. If the borders are smooth and round, it's good. If they are very irregular in shape, so this one's very bumpy, that's not a good sign. The color, so most moles are going to have a brown coloration or a pink coloration. If you have black or multiple shades in the same mole, that's a sign that you want to be looking for. The diameter, so if it's a large mole, that's another sign. And then if it changes in shape. Those are all signs that the mole is not just a regular mole, but it's a cancerous melanoma. And so you want to go to a doctor immediately. Eczema is an allergic reaction that can occur due to, any type of materials. So you can have, if you have an allergy against plants and you go out and you're playing around the plants, that can cause you to get this rash on your skin. It's very itchy, but it does go away. Typical treatment for eczema, you're going to use corticosteroid creams and let it air out. Psoriasis is an autoimmune disorder, so this one is genetically predisposed. So if you have psoriasis, it's in your genes. Your immune system is attacking the epidermis. So you have keratinocytes that are producing normal cells, but for some reason T lymphocytes are recognizing the keratinocytes as non-self cells. And so they start attacking, which causes the keratinocytes to respond by rapidly proliferating. So they start producing lots and lots and lots of cells. So we normally shed our skin every month or so, month to month and a week, just, between 30 and 35 days, right? And with psoriasis, we're producing a lot more tissue really rapidly, and then we're also not shedding the tissue like we normally would. The attack by the lymphocytes causes an inflammatory response, and so we get this itching, and the tissue that normally would shed stays and becomes a white patchy material. It can burn, and it, let me see if I can do, there we go. I'm going to do that so you can see that better, okay? So treatments for psoriasis, UV light actually helps to treat psoriasis, but too much UV light can cause skin cancer, so you have to be careful. Corticosteroids to reduce the itchiness. There are there are medications, so some type of drugs that will decrease skin cell production. You could also take immunosuppressant drugs to decrease T lymphocyte activity. Acne is a disorder we talked about before, typically seen in teenagers, can be seen in older individuals as well, though. The type of acne you're seeing here, this actually came from the Mayo Clinic. I looked up acne so I could get a nice picture. So you can click on here and you can go directly to the Mayo Clinic and get to their resources. This is cystic acne, which is a severe form of acne, where the plugged duct is deep in the hair follicle, and because it's so deep, you end up having large bumps under the skin that look like large cysts, or that form cysts. This can form on the face, on the neck, on the shoulders, on the back. Treatments for acne, for cystic acne, so over-the-counter treatments, anything that dries the skin will help with typical mild acne, but for cystic acne, they often will prescribe antibiotics because there are bacteria that are in those follicles that can aggravate and cause the acne, and that's Propionibacterium acnes actually can produce or can cause acne formation. And so when that happens, when you have cystic acne, they'll give you antibiotics to try and decrease bacterial activities. Also, they're going to give you creams to put on your skin that have a form of vitamin A called retinol that can help to decrease the inflammatory activity and help to cause the skin to go back to its normal coloration faster. Without treating the acne, you can end up with scar tissue, and that's something that won't affect your like mental capacities or physical capacities, but it can affect your feeling of self-worth. So it's important to treat severe acne early on so that the individual can go about their life without, worries of having scars on their face. The last thing we'll talk about disease-wise or issue-wise for the skin is burns. There are 3 types of burns that we talk about, and so I got this picture off of this website here. This is a beautiful picture of a first-degree burn. First-degree burns are burns that are only attacking or affecting the epidermis. So this is what you typically see when you go out to the lake and you're swimming for an hour or two and you didn't put enough sunscreen on, or you've been putting sunscreen on but your skin is just very sensitive. So she has a red skin, and you can see where she was covered is not red. The difference between this and a second-degree burn is that this is only affecting the epidermis. So you're going to have pain, maybe a little swelling, and after a couple of days, the pain will go away, and typically the burn will turn into a nice little tan. This is a second-degree burn. Second-degree burns are burns that go deeper than the epidermis. They go into the dermis. And they often have blisters. So there's a nice little blister here that are found with the burn. Second-degree burns are much more painful, and they can leave scar tissue. They oftentimes leave scar tissue. Depending on the size of the second-degree burn, you may even need to go to the hospital or the doctor and have it treated. A small second-degree burn, if you say touch a curling iron with your finger and you get a little blister, you can treat that using burn creams and wrapping it and keeping it cool. But if you burn too much of your skin, then you definitely want to go to the doctor so that they can protect you. The problem with burns when you have a second-degree burn is if that blister pops, then you're more prone to infection. That area is already compromised, so you don't want bacteria getting in because then that can cause a lot of problems. And then third-degree burns are full integument thick. So they go through the epidermis and the entire dermis. They typically go through the subcutaneous layer and hit the underlying tissues. When you have a third-degree burn, you're burning all of the skin under, all of the skin, all of the nerves associated with that region of your skin. And so oftentimes the region inside the third-degree burn will have no feeling whatsoever. But the areas around the third-degree burn up here, they're going to be second and first-degree burns, and they're going to have a lot of pain associated with them. So with a third-degree burn, the first thing you have to worry about is the size of the burn to determine how hydrated that individual needs to be. So if you have a third-degree burn, they're going to use a calculation called the rule of nines. This is how we calculate the amount of the body that is burned so we can then treat the patient. So we worry first about the amount of fluids that they need, because with a burn that deep, you're going to have dehydration. And with dehydration comes increased blood pressure and all kinds of other problems. So they're going to look at how much of the body is burned. So if one arm is burned, that would be 9% of the body if the entire arm is burned. If half of an arm is burned, that would be 4.5% of the body. If the front of the torso is burned, that would be 18% of the body. If both the front and back, that would be 36% of the body. So that's how they look at the entire body. And this is associated with adults. There is another rule of nines for infants, and I don't know that one as well. Once they get you hydrated, then they're going to have to debride the third-degree wound, which is very painful. And oftentimes, depending on the amount of the burn, the amount of area that has been burned, they might even put you in a medically induced coma while you are healing. But if they don't, then you're going to, depending on where, they will have to give you medicines to help you with the pain, and they're going to have to literally scrape the skin and tissue off of that area to keep you healthy, to keep your body healthy. They do skin grafts from other regions of the body on you to cover the damaged region. They can also use tilapia skin, that's fish skin, and that has been seen to really be a good healing tissue that goes over the skin and then helps that burn to heal. So the last thing we're going to talk about then is aging. And so with everything, so with all living things, age. We are born, and as we grow, we are aging. And with aging, so when things get older, they don't always work as effectively. And you've seen this with, your cars. It seems like right after you pay off your car, it starts to break down more often. I mean, it's older. So it always seems like it's because you just paid it off, but it's really because it's just getting older. This also occurs with our skin, with our integument. Our skin becomes less pliable, less stretchy, and so we end up with wrinkles that typically are found around our eyes, where we scrunch up our face more. You'll see those wrinkles. A lot of people call them laugh lines. So you get the little wrinkles around the eyes, the little wrinkles by the face. And some people don't like those wrinkles, which, it just depends on your personality. If you're more of a vain individual, you may not want to have wrinkles, so you may be, more prone to putting lots of different not cleansers, but creams on your face to help keep its elasticity. They have treatments with the integument or with wrinkles to help decrease them, and the most popular one is Botox. So I've had a student who was in my class who had Botox injections, and she just loves them. I've never had a Botox injection, and I don't think I ever would because it's not something I care about. So what Botox is, it is a chemical produced by Clostridium botulinum, and Clostridium botulinum produces a toxin called botulism toxin, which is very deadly. It causes muscles to not fire, so muscles can't contract and relax. So what they do is they take that toxin and they purify it, and I don't know exactly what they do. I can't tell you that because I don't know enough about Botox. But they take it, and once they get it purified, and they then inject that chemical into your skin, into the muscles. This causes the muscles to relax, causes collagen fibers to relax, and that decreases the wrinkles on your face. So it's very weird, but I don't like it, but you could do it if you wanted to. That is the end of our chapter, so I will see you in class, and I hope you enjoyed it. You should be able to do all of Chapter 5 questions at the end of the chapter, as well as any of the short answers that are there. If you have any questions, definitely ask. Bye.